Hello everyone. What I'd like to do today is provide a short step-to-step guide about what actually happens during a private ADHD assessment, what it looks like and what you need to sort of prepare for having one. So if you're thinking about booking a private ADHD assessment, you're probably wondering about what actually happens. Will it feel like an exam? What do I need to prepare? How long will it take? And in this video, I'd like to talk through the entire process and let you know exactly what to expect. So, before the appointment, you're usually being asked to complete 4 forms. That's so that the clinician that you're meeting knows sort of a little bit about who you are and what to expect, and also what questions to maybe sort of really dig into to get to know you better. The pre-assessment forms might be something about questionnaires about attention, focus, and impulsivity. It'll also include information about your childhood, education, and work. Sometimes you'll be asked to do sort of rating scales as well, and also get those from somebody who knows you well. You may also be asked to provide school reports if you have them, maybe previous medical or mental health records, and any past diagnoses. Even if this isn't for ADHD, sometimes it's really useful if you've had, say, a dyslexia assessment for the clinician to see that report too. Don't worry if you don't have everything. Clinicians understand that not everyone has access to these kind of records. On the day of the assessment, it's usually a video call or an in-person appointment lasting between 2 to 3 hours. It's not a test. You can't fail. It's a conversation. And any good ADHD assessment will actually be about what's going on for you and what explains the problems that you're facing, not just whether you have ADHD or not. What will happen then is a semi-structured interview. So this means that the clinician will have key areas that they need to cover, but they'll also ask to follow your story and ask follow-up questions. A good ADHD assessment shouldn't just be asking you the standard diagnostic questions and expecting a yes or no answer. So in a typical assessment, you'll explore what your current symptoms are. So for example, what are the struggles with focus, organisation, time management, your childhood experiences, the education and work history, your relationships and daily life, and your mental health and well-being. You might be asked for real life examples, like what happens when you try to focus? What happens when you need to organise something? How do you manage deadlines? This helps build a full picture and not just tick boxes. One key part of an ADHD assessment is understanding whether symptoms are present in childhood. That's because ADHD is a neurodevelopmental condition. It doesn't just suddenly appear in adulthood. Although sometimes you can get where symptoms may have been masked or not cause a significant functional impairment in childhood, they still should have been present for ADHD to make sense as a diagnosis. Now, if you're not sure, that's okay. The clinician will help you through it, or that's where having somebody who knew you well as a child can be so useful to have present in that appointment. So what happens next after the assessment? After the interview, the clinician will review everything carefully, and in some cases they may tell you the outcome on the same day, but most of the time they'll bring the information that you shared with their team. So you not just get one doctor's opinion, you usually get lots of doctors' opinions. With us at Attention to Health, that is what's kind of standard practice, because we like to make really sure that we're getting the diagnosis right. Once that assessment has been completed, your clinician will put all of that information into a report, and you should receive that in a couple of weeks. Also for a chance for you to check that it's right before it gets sent out to anyone else, for example, your GP. The report will include whether you meet the criteria for ADHD or not, a breakdown on your symptoms, and also recommendations for support or treatment. And you'd get this whether you have ADHD or not, because we want to make sure that you really understand what the problems may be, and for us to make good recommendations about what might help. A lot of people worry about being judged or not as being ADHD enough, but the assessment isn't about catching you out. It's about understanding your experiences and whether ADHD explains them. You don't need to prepare for perfect answers. You don't need to go on social media to find out what you should do. It's just a case of being honest. If you've been struggling with focus, overwhelm, or feeling like things are harder than they should be, an assessment can be a really important step towards clarity and support. Now, if you have any questions, feel free to sort of put them in the comments below, or check out our other videos on ADHD diagnosis and treatment. Thank you very much.